I want to talk about sodium valproate epilum, and that's a medication used to treat epilepsy and bipolar disorder. And the European Medicines Agency has restricted its use in women due to the increased risks of disabilities in children exposed to valproate in the womb. These disabilities are collectively known as fetal valproate syndrome and can include serious developmental disorders in up to 30 to 40% of cases and congenital malformations in approximately 10% of cases. Now, data suggests that up to 1,250 children may have been born with valproate-related disabilities since the medication was licensed in Ireland in 1975. And last year, the Oireachtas Committee on Health produced a report on fetal valproate syndrome, and the HSE established the Valproate Response Project Group to address a range of issues in relation to the prevention, the risk minimisation, the establishing incidence and diagnosis and supports for the families affected. A major conference will be held on this on the 22nd of March in Trinity College to discuss the consequences of sodium valproate epilum 50 years on. That's a really important conference, and I would encourage all senators across the House to go to that, and the media as well, because there is something to see here and there's something to hear. When I asked the Minister for Health in the committee, he said he would consider the need for an inquiry into the fetal valproate syndrome as soon as the HSE's Valproate response team has completed his work. So we need to know when this work is going to be completed and when he expects to further consider the matter. A redress scheme has been set up in France to compensate the families and individuals who have been affected by fetal valproate syndrome. It's urgent that we take a similar initiative here. The Minister must meet with the Facts Forum to discuss accountability issues as well as the redress. But can the Minister outline how long his department has known about the risks associated with the use of valproate in pregnancy, and what actions were taken by the state to minimise those risks, in particular prior to 2014, when the European Medicines Agency implemented its first review of risk reduction measures? And we need to know what is the Minister's response to the recent study published in the British Medical Journal, which concluded that evidence was clear as far back as 1990 that there were risks of congenital malformations in women exposed to valproate, and that the risks were beyond all doubt from 2005. We need to know, will the Minister explain what is known about the prevalence of fetal valproate syndrome within the Irish population? What clinical trials were conducted on epilum sodium valproate in Ireland prior to its licensing in 1975? And if no trials were conducted in the state, what clinical trial data was used for the basis for its approval? So there are many questions outstanding on valproate, and these questions must be answered. So, Leader, what I'd ask is for the Minister to come into the House to discuss this. We have waited long enough for the report, and in the meantime I would encourage everybody to attend that conference. And I really want to commend the mothers in particular, and some of them are coming in here this evening, who have campaigned long and hard for this. We have families, Cathaoirleach, where there's 2 and 3 children, all born with disabilities, because they were allowed to take valproate when they were pregnant.